Rhinoplasty is a really common procedure, especially in my practice, and a lot of patients have thought about it for years before they ever take this first step really to make it a reality. And when you're shopping around, looking online, it's really important that you find somebody for this very important decision that you feel comfortable with, and that you like their results and you feel confident in. And so a lot of what's going to happen when you come to see me is, getting to know me getting to know you, okay, knowing what your desires are, what you want. Talking about the functionality of the nose, because the nose is a breathing organ, and we have to make sure we address all those concerns. And then aesthetically, to understand what you like. I oftentimes ask patients, whose nose they like. I'm not going to give you that nose, but it gives me an idea of their aesthetic and the face that they kind of identify with, and it's a way we can start that conversation. And then, of course, we talk about, we take some pictures of you, and I'll use digital imaging to sort of morph things and show you what I think, my expert opinion would look the best for you. And it's also a great opportunity for us to kind of look at you, your picture, your face, together as almost like a third person, and for us to look and morph and decide what we like and what works and what doesn't work. So that's a real important process as well. You're going to get to know our office staff. You're going to get to know Suzanne. You probably know her well by the time you come in. And I just want you to feel that all your questions are answered, that you understand what the process is going to be. You feel comfortable with that. I'll send you those emailed pictures just so that you can look at them and decide whether that's something that that you like. And when I see you again in consultation, because I always see you a second time prior to surgery, you'll have thought about this. You'll have questions and thoughts that we can address, and we can change our plan slightly if we decide to do that. So it's a really important process, and it's one that I think people hesitate to committing to, because it's new. It's surgery, and it can be a big event, and it should be a very positive event for you. So I hope that that's the case for you when you come to see our office.